Hi, my name is Lee, and I live here in Richmond, Virginia with my family. I'm so excited that the Speak Now for Kids and Health Reform campaign has asked families like me to get involved. I have 7-year-old twin daughters who were born prematurely at 28 weeks. One of my daughters suffered a brain injury which resulted in cerebral palsy. Cerebral palsy affects her motor control. Luckily, she isn't affected cognitively, but she is dependent upon an adult for most of her activities of daily living. She uses a wheelchair for long distances and a walker for very short distances. While we've always had private health insurance through our employers, unfortunately it hasn't enabled us to meet Taylor's medical needs. She needs physical and occupational therapy multiple times a week to continue to strengthen her muscles and to help her function in daily life. Each year we would max out with our therapy benefits at least 3 to 6 months throughout the year, which resulted in us making a decision: were we going to forgo her therapy or pay out of pocket, which typically exceeded $30,000 a year. In most states, there are Medicaid waivers that certain individuals with medical conditions can qualify for, which will allow them to meet their children's health care needs. But unfortunately here in Virginia, the waivers have multi-year waiting lists, and the system is very, very difficult to navigate. This leaves families in a situation where they can't take care of their children in their own home, and they're forced to live in long-term care institutions. Not only is this terrible for the child because they're not living with their family, it's not allowing our children to reach their maximum potential. And what I've always wanted is for our country to invest in our children up front and early so that they can maximize their potential and be contributing citizens to our country. So based on my personal experience, I've realized that this healthcare system is broken and is failing. And what we need to ensure is that all the children in this country have health insurance and have the right care at the right time. As we know, this system was mainly designed for adults, and children are not many adults. There are at least 9 million children in this country who lack health insurance, and that number is sure to grow with the economy and the recession. It's not fair for parents to have to choose between putting food on their table and seeking medical attention for their children. So I ask that you join me in speaking out for children, for children's health reform. We need to make sure that Congress and the President hears our voice and let them know that we don't feel like children's issues are being addressed. So join me, all the mothers, fathers, grandparents out there who have children with special health care needs, or children for that matter. Please speak out to our country and let them know that we need them to take children's health into account in this health